Hello everyone, I'm a board-certified neurologist, a clinical professor of neurology at a major medical school and founder of a center for multiple sclerosis. I'm here today to talk about stroke. The purpose of this video is to share with you a message about stroke that hopefully will help people recognize the signs of stroke and hopefully get people to seek treatment quickly. I'm also here to dispel the myth that stroke is just an old person's disease. While it's true that the risk of stroke increases with age, stroke can and does happen to young people too. I know this firsthand because I suffered a stroke in 2019 at the age of 38. Prior to my stroke, I had no known risk factors and I was not aware that I even had high blood pressure, which contributed to my stroke. But I'm not alone. In fact, nearly 1/3 of all strokes occur in people younger than 65 years old. That's why it's so important to learn about stroke and know the signs. You see, time is brain when you're having a stroke. Every second counts. That's because when you have a stroke, your brain is literally dying. As the blood supply to the brain becomes blocked or a blood vessel in the brain ruptures, brain cells begin to die within minutes. And the longer that blood flow is interrupted, the more brain cells die. That's why it's so important to recognize the signs of stroke and get help fast. The good news is that most strokes are preventable, and there are things that you can do to lower your risk of stroke, such as eating healthy, exercising, not smoking, and getting regular checkups. But even if you do all of these things, you still might be at risk for a stroke. That's because sometimes there is nothing that you can do to prevent a stroke from happening. The bottom line is that stroke is not just an old person's disease. And knowing the signs of stroke could save your life or the life of someone you love. So let me share the warning signs of stroke with you now. The first sign of stroke is sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Next is sudden confusion, trouble speaking or understanding speech. Other signs include trouble seeing in one or both eyes, sudden dizziness, loss of balance or coordination, and a severe headache with no obvious cause. If you or someone you're with has any of these symptoms, call emergency services immediately. When you're on the phone with the operator, be sure to tell them that you suspect a stroke. Then do your best to stay calm and follow their instructions. They may ask you to perform certain tasks or observations to help determine if a stroke is occurring. Once emergency services arrive, they will assess the situation and provide medical care. They may take you to a hospital on a stretcher or transport you by helicopter or other means. If you're taken to a hospital, the medical team will perform tests to diagnose the type of stroke and determine the best course of treatment. So what should you do if you've had a stroke? First, don't panic. A stroke is a medical emergency, but it's not the end of the world. With prompt medical attention, many people make full recoveries from stroke. In the days and weeks following a stroke, you may need to stay in the hospital for rehabilitation. During rehab, you Ella work with a team of healthcare professionals to learn how to walk again or perform other daily tasks. But with hard work and determination, most people are able to return to their normal lives after a stroke. I hope you found this video informative. If you have any questions about stroke, please leave them in the comments below and I will do my best to answer them. You can also find more information about stroke on our website. Again, I am a board-certified neurologist and a clinical professor of neurology at a major medical school and founder of a center for multiple sclerosis. Thank you for watching.